The purpose is to give a voice to Southeast Asian immigrants, particularly the older immigrants, and allow them to tell their stories about health and healthcare here in America.
The Elders Council had the task of choosing the health-related topics that were most pressing to them and most important to them. And they chose hypertension, and really it made perfect sense. You have a group of immigrants and refugees who live in an environment with a lot of stressors.
What I thought was very interesting about the elders' decision to choose high blood pressure was the fact that when you look at the statistics, Asians are much, much lower in terms of high blood pressure than their counterparts in other racial and ethnic groups. But when we looked more closely at linguistically isolated communities, the rates are higher than in the Asian American community at large. So this is something that the elders had observed firsthand.
Hypertension is very important. It's a silent killer, and they can attack any time. If you don't know how to take care, to visit the doctor and to control the blood pressure.
Part of it is diet because you have lots of salted foods. There are also other things such as potentially a sedentary lifestyle.
They are under tremendous stress being in this country, and that absolutely figures into the hypertension situation. And many of the patients that we see from Cambodia in particular lived through really a Holocaust there. Most of them have lost family members. Many of them have seen horrific things.
Cambodia was bombed badly. It walked days and days and took us months and months across the country from one place to another, escape the war zone. We all were really exhausted and tired and sick and starved, so many people die along the road. It is hard for our older to talk about the experience.
Socially, dietary, the linguistic context in which they live, the post-traumatic traumatic disorders that they may be experiencing from war-torn countries, having been uprooted and thrown here. Hypertension is I found out to be a lot more serious than I had thought. I would say 99.9% of Southeast Asian seniors living in Philadelphia County do not speak English or do not speak English well enough to communicate their health issues with doctors.
They have to cross so many hurdles before you get to the doctor's office. Picking up the phone, and then there's an answering machine or voicemail, and you have to listen and press 1 or 2. That's already a challenge. And then from there, you have to navigate that complex system of healthcare.
I don't understand.
Okay, you don't understand it. Okay.
There are Chinese immigrants, there are Vietnamese immigrants, there are Cambodian, Laotian. We're seeing a lot of Indonesian immigrants lately over the last couple of years. There's a huge language barrier, and it is a major factor in the care that they get. It's a little easier to find people who can translate Chinese, the different Chinese dialects, and the Vietnamese language.
No dizziness or...
Cambodian is more difficult, and a lot of times we rely upon family members. If I'm giving instructions, for example, on how to take a medication, and it's not communicated clearly, the consequences can be very severe if a person takes the medication incorrectly, but it's also very big from the standpoint of just having that personal connection in a patient-doctor relationship.
I do see quite a few Vietnamese patients because they are able to communicate with me in their primary language. It's still somewhat challenging for them even though I'm their primary doctor, because once they leave my office, they still have difficulty accessing the rest of the care because I can't do everything for them. We also see a lot of families relying on young children to do interpretation for them, which also creates a lot of problems.
There are translation services in most hospitals. Smaller ones might have a list of people that they know in the hospital who work in environmental services or in nursing or another part of the hospital that speak a language that you can call.
When we did our research to look at how to teach health literacy in our settings, we realized that the materials that were out there were not very useful. Many of them were either written for an English-speaking population or is still written at a level that is too high for many of our ESL learners.
Our community, because most of the people who educated were killed, so those who survived and came here, have very limited of education. Majority of our populations, they can't read or write Cambodian, so it's harder for them to learn English.
We need to be able to help health professionals become better health professionals for this community. There are approximately 57,000 Southeast Asians living in Philadelphia County. Health professionals, despite good intention, don't know how to communicate, and not only on the linguistic level, but on the cultural level to their refugee consumers.
The medical treatment was very lacking in China, in Cambodia, in Vietnam. So instead, they probably had to use a lot of their traditional way of healing to help themselves.
The idea of going to the physician when they feel perfectly fine is really not within the scope of reality, especially when they have to deal with employment and childcare and transportation and other barriers.
They may delay their medical treatment to the point it might hurt their life. So it is probably fair to say they're more in line with the concept of natural healing, the concept of integrative medicine. The back of your leg, the older generations, they're always a little bit wary about the modern technology and tends to stick with treatment they're familiar with. Some people believe certain plants and animals would help their illness, disease, certain rituals that will help their illness and disease. In the Eastern religion, they believe the mind and body is not separated. Believing that you're living a healthy, good, happy life, you trying to watch your diet, watch your living environment, and pay attention to the change of climate, pay attention to a more harmonized family and relationships can play a very important role.
A lot of the elders don't even know how insurance works. Where I grew up in Hong Kong, I see the doctor, I bring money, and that's it. But insurance works very differently. When you are in this system, you're supposed to advocate for yourself. Is this medicine right for me? Is there another one that is more affordable? Is there another doctor that I can talk to? Can I see a specialist about this? That's something that is so much a part of the medical culture here in America that people don't recognize it.
In Asian culture, doctors are considered as God. So you don't question them, you just listen, you don't ask any question. The family members have a lot to do in terms of making decisions for their elderly. That kind of thing could create some issues.
Education is probably the most effective way to help them to understand.
They want to learn more information about what is going to contribute to a healthy lifestyle